some of the scientists are saying that Omicron is basically a blessing in disguise. Do you agree?
If you look at the mildest of the symptoms and the fast way that this vaccine spread, or not the vaccine, this variant spreads, and then yes, I think a lot of people will get nice antibodies. A lot of people will be infected without even knowing that they are infected. And going forward, that will protect them. However, how long our antibodies from natural immunity will help, it's not always sure. But the best is if you can have natural immunity with a vaccine, that boosts your immune system tremendously. And that would be the ideal thing to do.
Okay, if we talk about the hospitalization, the severity, and especially the death rates of Omicron, comparing with Delta or the previous strains we have seen, what is your observation?
There's actually no comparison. If you look at the Delta deaths and you look at the Omicron deaths, and in Delta we also look at the deaths that there was deaths that was recorded during that time and not recorded whether it's Delta or whether it has anything to do with COVID. We saw a huge increase in death rate. Although again with Omicron, very low death rates, more or less around about 100 average. But does this mean that we are going to have a severe peak again? No, don't think so at all. I think this is the same thing that will happen in India as well. You know, once school starts to open, people go back to work out of the festive season, you will see a slight increase. But you are not there yet. You are still in where the numbers are doubling. We know it. It's definitely.
And what is the oxygen requirement of the patients? What is the percentage? Do they require oxygenation or ventilation, if we talk about it?
At primary healthcare, out of the 114 patients, 116, it's only those 2 patients that we had admitted. There's another one that we saw yesterday with a pneumonia. But again, we're still waiting for some tests to come back, but not acutely ill, so that she warrants ICU or even high care admission. So I'm waiting for that. So if I look at the patients and those other 2 that had been admitted, they were on normal oxygen. So the rest of all these patients that we have seen, none of them have been ventilated. None of them had any need for home oxygen, because that is also very important. No need. And that is the same picture my colleagues are seeing at primary healthcare.